an idea of how you would do it differently and better. And he's also got a very popular voice. Like, if he decided to run for president, like, say if Trump, let's just make a scenario, Trump wins in 2024. He has 4 years. If Tucker went to run in 2028, he could win. He really could win, because it would be kind of carrying those policies, but also he's a sort of a no-nonsense guy who exposes bullshit in a pretty humorous way, in a very insightful and biting way. And that's what he was really good at on his television show. Yeah. And he red-pilled a lot of left-wing people. There's a lot of left-wing people during the pandemic that's like, Tucker Carlson's a propagandist and he's a piece of shit and is a right-wing asshole. And then as time went on, they're like, he's saying a lot of shit that's right. Like, why are they locking these tests? Why are they making kids wear masks? Like, is there any science to it? You know, there's actually science that just came out recently that said wearing an N95 mask for more than an hour a day is actually bad for you. Yeah, like you could get health problems from wearing one of those fucking things all the time.
Now we're being told this stuff.
Yeah, now we're being told this.
Yeah, and then New York Times came out saying a third of the deaths could be exaggerated. I don't know if you saw that or not. Yeah.
Well, Lena Wen on CNN said she thinks the actual death rate is 30% of what they said it was. And then you have the death rates that are due to those ventilators. How many people died that would have lived because of ventilators? Then you have all the other things that could have been done. You know, how many people could have been helped with different treatments that were made illegal or were prohibited? The treatments that were prohibited, like some of them were monoclonal antibodies, like which are absolutely effective. Like, what the fuck are they doing? Well, they had one idea, and that idea was make sure that people get vaccinated. And anything that takes away from that, including thymosin. Thymosin is a peptide that people were using to help battle COVID. Well, they made it illegal. They banned thymosin, which is there's no negative effects of thymosin. There's no peer-reviewed data that show it's dangerous. Meanwhile, fentanyl is still legal. You can still get – they're not stopping fentanyl. It's not legal, but it's not like they're not stopping opiates. They're not stopping all these things that we know absolutely do kill people and absolutely do cause harm and absolutely are addictive. They're not going out of their way to get rid of that.
Why do you think?
Because they want to make an extraordinary amount of money. The best way to make that extraordinary amount of money is to have one solution. You have one thing you can do, and you have to take this experimental vaccine that now we're finding out has massive health risks.
Yeah. It's pretty wild when you think. By the way, when you talk about Tucker, what you were doing on the podcast space, he was doing on the mainstream space.
Yes.
Like, very interesting. Now, when you think about talent, I'm sure if Fox invites you and says, hey, Joe, we'd love to have you on a guest for a 10-minute segment like that, I'm not doing a 10-minute segment. It's probably not going to be your style to go on Newsmax or Fox or CNN to give a 5-minute answer that you give. America doesn't want that anymore, right?